Hello, and welcome to the Family Involvement in Dementia Care Training Series. Family caregivers of persons with dementia face many sources of stress. The main goals for today are to talk about some of those common sources of stress and the importance of partnerships in caregiving, as well as introducing the family-focused training series that will use the partnership concept to hopefully ease some of the demands on you as a caregiver and provide a higher quality of life for your loved one. Did you know that 83% of all dementia care is provided by families and other unpaid care providers? So if you are feeling overwhelmed, know that you are not alone, and we are here to help. Family members assume many roles in many settings throughout the care journey with their loved one. The setting may be at home, during a transition between levels of care, or after admission to a residential setting. Within these settings, the caregiver may act as the proxy informant, the decision maker, or the advocate for quality of life. Each of these roles change as the dementia disease progresses, and along with every change comes new challenges. The role of a caregiver can be gratifying in many ways, but it can also create stress or burden for families. Let's think about each of these stressors now. The first is the change in family structure, function, and role demands for the caregiver. Perhaps one of the biggest challenges for dementia caregivers is understanding the disease itself and how the progression changes their loved one over time, such as the loss of function, abilities, and communication, as well as observing behavioral symptoms that may be uncharacteristic of the person with dementia. Other health-related problems like having the flu or becoming depressed can also impact your loved one's abilities, routine, and behavioral symptoms. Changes in the disease progression slowly increase the demand for the caregiver to take an active role in managing daily routines and activities, which can be wearing. It may be the challenge of explaining dementia and challenging behaviors to friends who are not caregivers and may not be familiar with the disease. It might be the feeling of being isolated as a caregiver and withdrawing from hobbies and interests that you used to participate in and enjoy. Or you may be dealing with conflicts within your family about the best approach to care for your loved one. All of these challenges cause additional stress and strain on the caregiver, which can lead to negative impacts on your own health and well-being. There are a variety of health-related implications that may be associated with being a family caregiver, such as depression, physical illness, social isolation, physical abuse, and substance abuse. Another source of stress comes from long-standing relationship patterns within the family. As we discussed earlier, as the caregiver assumes new and different roles, it can change how family members interact and relate with one another, which creates another set of issues. The caregiver may be experiencing a loss of a former role. They may be taking on additional roles or responsibilities that the person with dementia used to manage. And then, of course, the comfort or discomfort with those new roles and expectations. When we think about family relationships, we also need to remember that each family has strengths and weaknesses. We each have our own unique problems and issues, some good, some not so good, that can be further aggravated by caregiving roles and challenges. The time required for caring for the person with dementia competes with everything else, balancing work and leisure, spending time with other family members, taking care of the caregiver's own health, and managing the financial side to caregiving. The other huge issue is that sense of what's next. It's hard to get into a routine because the disease constantly changes the demands on the caregiver. A final source of stress we will discuss today relates to the stress of decision making. Caregivers are bombarded with needing to both give up control to others and take control over things they may not have previously managed. It's tough and can lead to disagreements with other family members or providers, and feelings of uncertainty about what's best or what the person with dementia would want. With all these different sources of stress, along with many we have not mentioned, it is easy to see why there are many emotional reactions that are both very common and very understandable. As a caregiver, you may be feeling a sense of loss and sadness of the person once known, or the previous way of life, or a sense of anxiety and worry that your loved one may suffer, or even your own fear of being alone. Many caregivers report feelings of guilt and regret, the should-haves and could-haves, and sometimes it may be the feeling of anger that it just isn't fair. Being partners with providers can help to ease the stress of being a family caregiver, as well as contribute to a higher quality of life for your loved one. Partnership means focusing on good communication skills, which includes asking questions if something is unclear, and bringing up concerns that you have. It also means being prepared. It involves an effort to work as a team with providers, and taking the time and effort to understand your own needs, as well as the provider's point of view. By using a partnership approach, we can all stay focused on the goals of care and the ultimate goal of a high quality of life for the person with dementia. Our 10-part training series will dive into each of these topics listed here, and we hope the series will help reinforce things you already know, but may sometimes find hard to do, and also give you some new ideas on how to interact with formal providers and staff caregivers. Woven into each of these topics are keys on tailoring care based on your loved one and their unique interests, as well as how to share this information with providers so they can know your loved one's likes, dislikes, and preferences to individualize their care. We recommend using the training as a series, as content builds throughout the topics, but each can also be viewed independently if you prefer. We invite all learners to be creative in how the training is used, possibly as a self-directed activity or in a group setting with others who have shared interests. Within each topic, there are breakout pieces for self-reflection or group discussion, real-life scenarios, and tips from family caregivers to provide additional information. We also want to note that this series works alongside a provider-focused training series that includes many of the same ideas. Our goal is to give family members and staff providers a common language about being partners. The first topic in this series is called Talking with Providers and is about communication strategies that can help family members get their messages across. If you are ready, let's get started.